Well, good evening. My name's John Carney. I'm your governor. I'm here with the Secretary of Health and Social Services, Dr. Odom Walker. We're here tonight to talk about healthcare. This is a Facebook Live format that we've been doing a couple times. We had a live session a couple months ago on schools in the city of Wilmington with Darrell Green. It's a great opportunity to reach out to people of our state. Tonight we're going to be talking about healthcare and the things we need to do to make Delaware healthier and to help people live healthy, productive lives. One of the more important challenges that we have that I have as your governor and Dr. Walker has as Secretary of Health and Social Services. Last year, as you may remember, I did about 20 town hall meetings up and down our state talking about our budget challenges. We had a $400 million deficit that we were trying to address through a series of revenue increases and cost spending cuts. And tonight, last week, we presented a budget that did not require tax increases and that addressed some of the challenges facing our state in education, investing in economic development, infrastructure, and investing in healthcare. Part of that budget included additional money for substance abuse treatment facilities and dealing with substance exposed infants. And we're working, waiting for recommendations coming from the Substance Abuse and Mental Health Consortium, which is chaired by our Lieutenant Governor, Bethany Hall-Long. They're doing a really good work. They're about to do a number of community forums four community forums across our state in Wilmington and Delaware City, in Dover and in Georgetown, and as a result of the feedback they're going to expect to receive from the public, we'll make some further decisions about different investments that we need to make to address these problems across our state. I believe strongly when I was your congressman, going back and forth to Washington every day, the biggest challenges that we faced as a country was to control our healthcare cost inflation at the federal level. Of course, it's Medicare and Medicaid, significant drivers of federal spending and federal deficits at the state level. Of course, it's Medicaid. The other half of the funding for Medicaid comes at the state level. Those healthcare services are provided for low-income families, for people with disabilities, and of course for the elderly in long-term care facilities, a significant burden, and we're working on a benchmark process to try to bring those costs down systematically. It's a big challenge that Secretary Walker and her team have and that we'll be working on with members of the General Assembly. One of the things that I learned as Lieutenant Governor, I did a lot of work trying to get Delawareans to eat a healthier diet and be more physically active, and I know Lieutenant Governor Hall-Long intends to do the same thing, is that we both spend too much money on healthcare. And we're not as healthy a state as we could be. And so we've got to work on both sides of that equation. So I look forward to hearing your questions tonight. We'll start with some questions that have already been sent in to us. And we'll start with the questions after Dr. Walker has an opportunity to say a few words to kick off the evening.
Thank you, Governor Carney. It really is a pleasure to speak with you this evening. We're particularly emphasizing our work around the healthcare benchmark. But we have many challenges in our state. We're trying to figure out how to better serve those who are suffering from addiction. We know that many people have been affected by this huge influx of additional opioid addiction in our state. So with the benchmark, we are working on how to look at healthcare costs up and down our state in different categories. And it is going to be a collective undertaking to bring stakeholders together and really figure out what is driving high costs of care, where we're third highest per capita in our country. And this is certainly a challenge across our nation right now. As the governor said, it's been a long-standing issue in healthcare, but we certainly want to figure out how we also embrace patient choice, opportunities to promote better primary care, how we figure out how to better coordinate services, and continue to emphasize that quality is important in all of those settings. So how do we really move forward with looking at where healthcare costs are? But it's not just about reducing. We also want to make sure we're maintaining high quality care for all patients who are seeking it. So I'm really pleased to have this dialogue. Please do send us your questions this evening. I do have one question to get started with.
That'd be good.
So what can be done about the ridiculous cost of medications? A pill that costs $1 shouldn't cost the consumer $100. And this is from Yvonne Cole-Herman. Thank you for that question. And we do have a lot of work to do around the cost of medications. This is, again, an issue that is not just particular to our state, but certainly one that affects us dramatically. And we've seen that whether you're looking at costs of care in hospitals or nursing homes or primary care or home health, certainly drug prices are one that have gone up across all different categories of medications. It is a challenge to figure out how much those drugs should cost because it depends on what your insurance coverage is and how those negotiated prices are between your prescription coverage. We know that sometimes costs get shifted from one place to another in healthcare, and that's something, again, we really need to figure out how to bring in partners, how to work with the pharmaceutical industry and others to think about strategies to make this a better and more clear set of prices for consumers, for patients who are trying to make sure they have access to the right medications. But it's a challenge.
It is a challenge. And just think about my own experience with when I moved into the state healthcare system, I was directed to a formulary in Express Scripts, and I got a price that was 1/5 of the price that I was paying prior to that. So encouraging state employees to take advantage of those formularies, I think, is part of it. Price transparency is part of it, so we know what the actual prices are that people are paying. And if we can do that, you can, I think, drive a fair amount of cost savings just by those kinds of practices, but a big challenge for all of us. Another question that we've received, are you going to bring back the Delaware Prescription Assistance Program for low-income seniors who cannot afford their medication? And this question comes to us from Tricia Bailey Robinson. Tricia, we are going to bring part of that program back. The program was eliminated in last year's budget in part because we had to find savings of $200 million in addition to the $200 million of new revenue that we were seeking and that we ultimately was approved by the legislature. The prescription drug program was targeted last year mostly because of the feeling that the Part D prescription drug program from Medicare at the federal level was picking up most of those folks. What we learned was that there were individuals who were really adversely impacted, meaning that very much affected them financially by eliminating this program. So we're bringing it back with some modifications to address some of those cases. We received a lot of feedback from legislators. I know Senator David McBride, who was the original author of that program, talked to us about it, as well as a number of the constituents calling in. So that's something that we're going to bring back at some level with the hope, again, that other programs that are part of the Affordable Care Act, there's certainly a lot of uncertainty around that with what's happening in Washington and Congress and the president. But the expectation is increasingly with Part D and other coverages that we won't need that kind of coverage. But we are focused on helping those folks that were really adversely affected last year.
And I would encourage any senior, any family member who is struggling with prescription costs to definitely reach out to our department. We're happy to review what your medications are and see if you're eligible for other kinds of prescription assistance. Sometimes it is very complicated to figure out if this prescription could be better negotiated, if there's a certain program that could lower costs. So we are happy to work directly with anyone who is struggling to make those medication costs. And, I provided care for many low-income, vulnerable seniors in the past. I'm a board-certified family physician, and one of the things that is really critical and sometimes hard to figure out, even as a physician, is how much should these medicines be? What is a formulary? Are there other options? Are there other categories of medicines or other generics that you could be switched to that are just as effective? So please ask your doctor, make sure you're asking them, is this the best choice for me for the best cost? And if you're still having challenges, feel free to reach out to us for additional help.
Great, thank you, Dr. Walker. Next question we have is from Judy Juster, and this is a question that is not directly healthcare related, but it does, the quality of our air and water does affect our health. And this is the question: Delaware needs to improve both air and water quality. Can you make suggestions, please? I will, and I'll talk about air quality first, one of the best thing that we can do, since most of the air that Delawareans breathe comes from the west of us. The prevailing winds are west to east, and the pollution that is created by mostly electricity generating power plants in West Virginia, Western Maryland, Pennsylvania, and Eastern Ohio, we get that dirty air here in Delaware. The fact of the matter is that most of the coal-fired burning plants here in the state of Delaware have been converted to natural gas. Natural gas is a lot cleaner, not completely clean, of course, and that's why we continue to promote other technologies for generating electricity. But coal-fired plants really generate some of the dirtiest air, particularly if there aren't cleaning machinery on the back end of those plants. So the clean power rule, which the president has talked about rolling back, is really important for our state. I have sent out letters to EPA encouraging them to enforce clean air rules against states to the west of us. That's frankly the best thing that we can do for clean air in the state of Delaware. With respect to clean water, I mean, my belief has always been that there are certain things that we should focus on as elected officials and concerned citizens in our state. Cleaning up our inland bays is one of them. We have a very effective nutrient management program that is coordinated through the Department of Agriculture in Lower Delaware, just essentially to make sure that the nutrients, the fertilizers, the manure that's being spread on agricultural fields in Kent and Sussex County is in balance with what can be absorbed by the crops that are being grown and in the natural systems. And we've done much better at limiting those nutrients. I was down just about a year or so ago in Laurel, where the Department of Agriculture was demonstrating how to put in cover crop, which takes up those nutrients that otherwise would get in waterways and into the inland bays and contaminating those waters that we enjoy so much for recreation. And it also affects drinking water, of course, groundwater, drinking water in those areas. Really interesting technology that the farmers were learning about to help them reduce the nutrient loadings. What we do know is that we've, through generations of farming practices that weren't as scientific and weren't as efficient in the use of those nutrients, have caused the soils to be saturated with pollutants that then wash through the system and into our inland bays and streams. So it's something that we need to work hard on, and I'm confident that as time goes by, we'll be able to continue to clean up those waterways as we have over the last few years. So great question by Judy.
The next question is, do you believe private facilities should at least have 10 free beds for those who want help getting clean? From Nikki at Beglin. So thank you, Nikki, for that question. We certainly want to make sure that people have access to services for mental health and for addiction when they need it and when they're ready. And a lot of what we're focused on in our division of substance abuse and mental health is ensuring that people can get help when they're ready and when they're able. Some of that requires having bed availability, but we also need to remember that a lot of addiction is a chronic disease. When we've had 308 overdoses in the last year, we know that we have a huge need. We've estimated anywhere from 11,000 Delawareans are suffering from addiction in our state. And so it really is important that we remember that when people are ready, sometimes that means they can get treatment from an outpatient facility. Sometimes that means there could be a primary care provider who's ready to help them get access to the right treatment. We really do want to emphasize that there are resources available. Please visit our website, helpishere.de.com, where we do provide a list of facilities and locations where you can get access to treatment resources. Many of those facilities do have availability at any moment, and so we're also happy to help people navigate if they're having challenges, and the phone number listed on that website will also help you figure out where they're available. I mean, addiction right now is such a crisis in our country. We know so many people have been impacted. It's hard actually to meet someone who has not been touched by the opioid crisis and by addiction and mental health issues. So we are working and redoubling our efforts to really support the concept that we need high quality care that's supporting people where they are, and that we're forgiving when people go back into use and then come back and want to start recovery. And that path is a long one, and we need people to be willing to talk about it openly. We need to destigmatize what it takes to get back into sober living, and we need to support people on that path, because it requires more than just treatment. Sometimes it requires supportive care that includes peers who have been through this before. It could include jobs, employment strategies, and other supports. So this is a high priority.
It really is a priority, and it's a really, really serious problem. One of the things that I learned as a non-medical practitioner when we did a series of town hall meetings a year or two ago was that in terms of getting people to treatment, most times they're not going to take that opportunity unless they've hit rock bottom. And we have to be ready when people are ready to provide the services that they need to get clean. And that's why it's so important to have this website, helpisherede.com, and to make it available to friends and loved ones that you know who are struggling with addiction, so that when they are ready to take treatment, the treatment is there. We heard testimony from folks who lost loved ones because they overdosed before they were able to get to that point. So a really, really important issue in our state. So the next question is on a little different subject, is among state employees, how much are they paying for premiums versus how much the state is paying? And this is a question comes from Sam Fish. Well, the percentage that state employees pay as a portion of their premiums for health care was put in the state law by the legislature a couple of years ago at about 10%. So the state taxpayers pay 90% of those premiums, and state employees pay 10%. With respect to the private sector, the average is around 75% the employer pays and 25% employee pays. Now, those percentages have changed over the last 10, 20 or more years as healthcare costs have risen. Private employers have had to, in order to stay in business, to shift some of those costs onto their employees, something that they often don't want to do because at times they end up losing some of those employees who go to work somewhere else that has better benefits in terms of health care. The state benefits are among the richest, if you will, the best in the workforce. Our employees don't quite get paid as much as comparable positions in the private sector, and so there's a balance that needs to be struck there. What I do know is that the healthcare costs covered by the state for state employees and retirees is about $600 million a year. A similar amount with Medicaid coverage for people in our state, and so that both of those obligations are significant, and we need to take all the actions that we can to limit the increases both among state employees and Medicaid. So there's a lot of things that we need to do. The benchmark is an important part of that, getting people to live healthier lives, getting regular physical activity, eating a healthier diet, taking care if they have chronic conditions, and then driving down prescription drug costs, driving down costs and prices in the system more generally through the benchmark. There's just a ton of work that needs to be done.
And the more we can focus on transparency and guiding people through better points to make decisions on, I think can help all of us. If we can figure out, how to give feedback that what you're doing today is really providing lower costs for everyone, whether it's taking care of your diabetes or getting some exercise or making sure your blood pressure is under control. We also have done a lot to educate people about how much it costs to go to an emergency room versus going to an urgent care or going to certain laboratory facilities. And so there's ongoing work that we're trying to do to educate our state employees about healthcare costs.
So another big part of that, of course, is, health insurance is like other insurance products. We're always, you're going to need it at some point in your life. Something's going to happen to you where you need to go and have a procedure in the hospital, or you're going to need to get regular checkups and that type of thing. And you want to have the coverage that is good for you during that period of time. But you also want to take care of yourself so that you can avoid costly procedures that frankly burden the system at large. So the population kinds of health things that we need to focus on are important as well.
So I have a question that says, how do you feel we can best align health providers, health systems, and the state around health when reimbursement is still procedure driven? Homer Khan. So thank you for that question. We are certainly interested in how do we really move from paying for a visit or paying for a test or a procedure to paying for health. And that is a big undertaking, but part and related to what we're doing around the healthcare benchmark. Underneath of that, there are many strategies that we want to see if we can do in the state in collaboration with health system partners and providers to really pay for the outcomes that we expect. How we can get fewer people who have diabetes or fewer people who are suffering from heart attacks or stroke. I think there are all these preventive things that we need to incentivize. And healthcare is a very unique industry that we don't necessarily have a lot of understanding of where those costs are going up. And we're hoping that the healthcare benchmark can give everyone additional insight. To move to value-based payment, we need to continue to make steps to get our providers ready for that big change in how we're paying for healthcare. We're doing that in our Medicaid program through changing the way we contract for that care, where our managed care organizations are now going to have incentives built in if they are able to achieve certain quality measures, certain indicators of success, whether people with diabetes are better under control, have their diabetes under control, or whether more women who are pregnant get their prenatal care. We know that those things matter and those things make people healthier. So let's start to pay for that. But we still have to learn as we go and provide time to get our provider community together, have them tell us what is needed to make those transitions, and we can really be on the leading edge of allowing the state across all providers to really move into that direction of having value-based care, value-based payments be the way that we pay for healthcare in our state.
And as you say, that's going to take time. I mean, at a minimum, the providers, the hospitals, and other providers have to get systems that have real prices, right, and where their prices are transparent, so that you think about it, so that it can be a consumer-driven system where if I need a procedure, I can go to Christiana Care and say, let's just say I need a new hip, and I can say how much it's going to cost me for that hip, because I've got to pay, let's say 25%, or if I'm a state employee, I've got to pay 10% or whatever the case may be. Whether that hip costs $25,000 or $20,000 or $15,000 makes a difference, but you have to have systems in place where that can be done. Now, there were a number of pilots across our country a couple of years ago when I was again in the Congress that the physicians and hospitals were looking at commoditizing the various hip procedures, heart procedures, and the like, so that if you lived in Milwaukee, the cost for a hip replacement was the same or similar as if you lived in Philadelphia or Wilmington, Delaware. And I can tell you that's just not the way it works now. And as you said, Dr. Walker, we also have to incentivize using the healthcare system efficiently and taking advantage of availing yourself to the kinds of tests that would determine early whether you have, colorectal cancer or some sort of problem that would be more costly down the road. That's why the emphasis on early treatment and diagnosis is so important. We have a bit of a question from Brittany Scharf, I think it is, who wants to have an explanation of the 12-week, I think this is 12-month maternity and paternity leave for state employees. So there's a legislation that's currently been introduced in the legislature, which I've come out publicly support, which would provide paid family leave for a father or mother and the birth of their child. I just think it's the right thing to do to support families, to support mothers in particular at the birth of their children without penalize them, if you will, so that they'd have to use a lot of additional vacation time and sick time, and even borrow that from some of their coworkers, which is something that's available now. Now that legislation has just been introduced in the General Assembly. I think it's a legislation that's important for our workforce and for our young families, particularly mothers and their babies. And I think it's an idea that I've heard some talk about it in the State of the Union address the other day at the national levels. So that's something I think whose time has come. One of the things I would also encourage people to do is to ask questions. We need questions and comments as part of this live town hall meeting here on Facebook. So if you have questions, please get them in, and we'll be answering them here.
Yes. Keep sending them. So the next question is, the state needs to start looking at Vivitrol injection for outpatient opioid disorders versus people having to line up at methadone clinics each day, from Chris Moore. So thank you for that comment and suggestion. And one of the core elements of having a successful statewide opioid plan is to really figure out what treatment works for what individuals. Vivitrol is a wonderful treatment option for certain people, but really what we're trying to do with any of these treatment options is prevent overdose and prevent deaths. We have had an unnecessary and unprecedented number of people dying from opioid use disorders. And so Vivitrol is one element that has been proven to be effective for certain people, but it also can put others at risk for overdose. So there's a range of treatment, including Suboxone and methadone, that really just have to be tailored according to that person's severity of their condition. And the wraparound services are critically important for any kind of medication-assisted therapy. Sometimes people really need a peer who's been through it, who knows the struggle, and can walk them through what works for them. Sometimes people really just need someone to meet with them every day for a little while. And others can do okay with the outpatient treatment plan where they can go once a week. And so we really have to be flexible and, again, destigmatize the idea that some people do need medication-assisted therapy to be successful and to stay clean and sober and have successful lives and work and be with their families. We are really trying to figure out how to support that transition, because when people are at the point where they're ready, they want treatment, we want to connect them immediately. And whether that's in an emergency room setting, or whether that's at the site of an overdose with an EMS provider, or whether that's with a first responder who is, in our police force, we want those individuals to say, I want to do a warm handoff to a provider team who can get you stable, who can get you into treatment, and then let's create a long-term plan. And for some people, that could be outpatient therapy through one of these strategies. For others, it might be something like an inpatient stay. And for others, there are so many different pathways now that we have in front of us. So thank you for that.
And it really does take a team approach, at every single level. A lot of the particularly overdose victims end up in the emergency room, and you have physicians there, you have emergency responders, you have family members. I know I spent a night watching what was going on at St. Francis emergency room and talking to the emergency room doctors about the kinds of cases that they saw in the city of Wilmington. Often they'd get a call, this came from the EMS folks, and they'd go out and the person would be by themselves. If this was a call that they got in Kent County or rural Kent County, somebody would find it would be a family member, and they would find the person who had overdosed, and they would be there with that person. So a very different set of circumstances. And so everybody along that handoff, as you say, that partnership, that chain, needs to be working in sync so that we can save lives, number one, and hopefully get people into the treatment that they need.
And I so appreciate the work of our Lieutenant Governor.
She's doing great.
Behavioral Health Consortium. And again, if you're interested in this area, please do attend the community forums we're looking forward to more questions.
And she's a nurse. She's an expert herself. She's leading up the consortium, so she's really doing a great job up and down the state. This next question's an easy one. Did the governor get a flu shot this year? In fact, I did. We had an event with you. Dr. Walker gave me the flu shot down at the Del headquarters. It was an event where we were encouraging people to come through and get flu shots. And the important message about flu shots is, do it for others. Not just yourself, but do it for others, so that you're not carrying the flu and giving it to your loved ones. And we were talking beforehand, we're all big Eagles fan, and we're getting all excited for the weekend, the big game on Sunday. And apparently, as a result of the interaction that people have during Super Bowl parties and the game and the like, that people end up passing the flu along to one another. So think about that as you're watching the Eagles beat the Patriots on Sunday, and maybe even get a flu shot before, just in case. But yes, I did get a flu shot, and the idea was to set the example.
Yeah, we have a lot to do to prevent flu. So, we've had over 300 cases confirmed in our state and 3 deaths, unfortunately, due to the flu. So if you haven't gotten your flu shot, please do get it. And if you do have it, stay home and don't pass it around to your friends and coworkers, so that we can prevent others from getting it.
Don't forget to ask those questions. We still need more questions coming in.
We're looking forward to them. Here's another one. How can you help in providing more coverage for dental services in the state? Oh, that's a great question. So we are definitely interested in improving the access to high quality dental care that people have in our state. And it really is a challenge, because we need more dentists to come to Delaware. We need more people willing to provide general dentistry care as well as specialty dentistry care. And so we're actively talking about ways to improve the services. We know that in Medicaid, people have asked us to increase the payment rate and include that in our program. And I think that's an ongoing question. But we know that oral health is important, and any way we can support more people getting the preventive care. There are many federally qualified health centers that do provide dental care. So if you are trying to figure out how to find affordable care and could be eligible for care through our community health centers, please do reach out to them.
There are other services, and generally once a year we have the Dental Association has a Give Kids a Smile Day in the spring, and dentists up and down our state make themselves available for children to come in and get cleanings, get checkups. They've actually do extractions, fill cavities, and the like. So that comes, keep your eye out for that. We do try to do all we can to provide services for dental services in some of the clinics. So make yourself available to those. This question comes from Dee Dee. I won't say the whole name, and I would recommend that you call our office so that we can help them. But the question is, between my monthly health care bill, I assume that's your monthly premium, and your deductible, you can't afford to go to the doctor. It's a struggle. And again, Dr. Walker just talked about federally qualified health centers. There are a number of them in our state, here in the city of Wilmington, in the Newark area, in Kent County, and in Sussex County as well. Those provide physician services at a sliding scale, so the ability to pay is important there. And I would recommend that you go to one of those facilities, Westside Health, and Henrietta Johnson in Wilmington, Kent County Healthcare, and Lared in Sussex County. And call our office too, and we can also provide some assistance there to get that kind of help.
And this is one of the reasons that we know looking at healthcare costs in our state are so important right now. Many people have come to us and said, my premiums continue to grow, my deductible is growing, the amount that my employer can pay is reducing, and I'm putting out of pocket much more than I can afford. And so we have to really figure out that affordability issue in our state. We certainly know that small businesses have said it's even harder for them to provide care and provide healthcare coverage for their employees, and they're often making difficult decisions about plan choices. And so we're hoping that the benchmark will allow us to have a more robust conversation around healthcare costs and, again, quality. If you want to learn more about the healthcare benchmark, you can check out our website at choosehealthde.com. We have some simple graphics that will describe what we're doing around healthcare costs in our state, and I hope you take the opportunity to learn more.
We've actually made some pretty good progress, mostly because of the Affordable Care Act, the expansion of Medicaid services. There was a time when I was lieutenant governor and chair of the Healthcare Commission where we had about 111,000 Delawareans without health insurance. We're about half of that now. Obviously, still a lot of folks that don't have health insurance, and these are people mostly who go to work every day and just don't have health insurance provided by their employer. Maybe they're an individual who has their own business or an individual contractor and is not able to afford it. So we've made some progress on access, and we got to think about both access, quality, as Dr. Walker said, and cost. And as we try to push costs down, or at least keep costs going up at a rate that's consistent with the growth in the economy, that'll help small businesses better afford coverage. It'll help small and large businesses afford coverage for their employees, and it will enable us at state government at the federal level to provide the services they're needing without driving our budgets out of control.
So I have a question about addiction. What are we doing about long-term treatment for addiction? By Carrie. What we know about addiction is that it's not an overnight fix. I mean, you have to be committed to it. For opioids in particular, we know it takes at least 2 years for people's brain to be reconnected and to be able to manage the changes that happen after opioid use. And I think this is why we really have to have a system that's oriented to helping people maintain that long-term treatment, and also know that not everybody's going to be the same. Some people will be in a good place after a year. Some people, it may take 5 years. We need more primary care providers in our state able to provide addiction services. Right now, we know that we only have about 6% of all physicians able to prescribe MAT in our state, and we do need more. We need more capacity because many people are suffering and looking for options that don't necessarily require, again, a short-term stay or a short-term treatment stint. So we look forward to, again, partnering with providers in the community and looking for technical assistance to help those who want to learn or want to access care through telehealth and telemedicine to ensure that everyone up and down our state can get access to high quality care.
So the next question, again, thank you for your questions and please keep them coming. We're still got some time left here in this town hall. This question is, what is being done to help those with physical and cognitive disabilities live in their communities? Actually, in Delaware, quite a bit is being done to accommodate the citizens of our state. We have among, I believe we have among the best programs in our K-12 system. People with disabilities kind of age out of those programs when they reach age 21, and that's really where the biggest challenges come for families, how to support their loved ones in the communities. Certain individuals, let's say if you're somewhere on the autism spectrum, like my niece Lorraine, my brother-in-law used to always say, it says it takes a whole community to help us raise our daughter and to support her living on her own as she does today. And considerable resources are spent through Medicaid supporting those individuals. I mentioned earlier on tonight that Medicaid not only provides services, healthcare services for low-income families, it also provides services for people with disabilities, and it provides services, long-term care facilities for the elderly in the twilight of their lives. With respect to those services, Medicaid services for people with disabilities, the average cost per enrollee each year is about over $30,000. So those monies are going to support individuals with their various healthcare needs, as well as providing support so that they can live productively in the community. More and more employers, including the state of Delaware, are encouraged to hire people with disabilities, cognitive and physical disabilities. We have employers that are doing a tremendous job of that. Companies that specifically are designed to provide opportunities for people with disabilities to work in a productive way. And I think that's probably the biggest challenge, is to make available in the workforce places where people with physical and cognitive disabilities can work in a productive way, can be accommodated with their travel to and from home, can have the supports that they need to live independently as possible. I mentioned my niece Lorraine. She can't be completely independent, but she gets services provided by Medicaid to enable her to live somewhat independently and supported by her family. So lots of different arrangements, lots of creative arrangements that are necessary to support these individuals, and we need to keep working at it. There's a bit of a discussion going on within the disabilities community about how to best serve individuals in independent living circumstances and group homes, so to speak. But there's certainly an effort to move people out of institutional settings and into settings where people can live more independently. And that just requires a lot of creativity. It's very expensive, or can be very expensive, and challenges us as other of these healthcare costs do as well.
And if you're looking for ways to navigate, you can definitely call 211 to help connect you to services and programs that may be right for you or your family. So here's a question about, there is a need for more mental health doctors in Delaware. Many are struggling and need help. Dee Colley, thank you for that question. We absolutely have a shortage of mental health providers in our state and have had areas designated as health profession shortage areas. We definitely want to figure out how to address this, how to get more providers to come into Delaware. Some of that is thinking about creative ways to bring people in, whether that's our state loan repayment program for mental health providers, or whether that's really helping to create a pipeline where there's training opportunities and other services. We are really proud that Christiana Care is going to launch a new residency program for psychiatrists. I think that's another example of how these conversations feed into one another, that we do have a challenge. We need more people ready to take care of mental health issues, and so there is a need being filled. We also train physicians in the Delaware Psychiatric Hospital on our campus at DHSS, and that's another way that we're providing for additional workforce, but we have to make sure we're retaining them and keeping them here. We have a changing landscape in healthcare. Certainly addiction and mental health issues are a core part of the governor's action plan, which we're really pleased to bring different partners together to figure out how we're coordinating a better mental health system for those who are really suffering, whether they're coming out of prison or whether they're really suffering in communities, and making sure that people have the supports that they need. But we also have other challenges. We know that our demographic is aging, and we certainly also need to think about how we're going to provide for those who are trying to live at home as long as possible, and how you provide those supports. So we have to really be creative about the workforce that's helping with healthcare in the future. It may look very different from what it is now. It may rely on telehealth and really allowing technology and mobile phones and other strategies, video camera and live streaming to allow people to talk to their doctor, or be diagnosed, or send pictures. And I think that's the future. That's what we want to really encourage, is how do you address these shortage issues with new and innovative strategies.
We've always struggled to have with shortages of healthcare providers and doctors in particular in the low in Kent and Sussex County, and we have had programs. We have programs to provide incentives for physicians to locate in those what are technically called underserved areas, and the mental health professionals are chief among them, and so we continue to work hard on that. So we have one more question, and it's a great question by somebody who's worked hard to to support great healthcare services here in our state, Betsy Wheeler. Her question is, does the state have a position on the looming funding crisis for federally qualified health centers? And the answer to that is we're going to work really hard as we possibly can with our congressional delegation, Senator Carper, Senator Coons, Congresswoman Blunt Rochester, to try to get the funding to keep those really vital healthcare centers open across our state. They do tremendous work. They provide first-rate healthcare services, physician services for a whole range of people with various incomes on a sliding scale, underserved populations for sure. In each of the 3 counties, they do tremendous work. And interestingly, I'm surprised that there is an issue at the federal level for funding, because they are programs that are supported by Democrats and Republicans across the political spectrum. Certainly here in Delaware, those centers are supported by Democrats and Republicans, and with my experience in Washington, the same was true there. It's a great way to provide good, high-quality service for people in underserved areas, in particular, mostly low-income folks that don't have access to insurance. Some have access to Medicaid, and they become the providers that provide the service there. And so really critical service delivery here in our state. Those centers do great work, and we're going to work hard to keep them busy and working in each of our counties. So that's the last question. I want to thank Dr. Walker for her leadership at the Department of Health and Social Services. She was providing medical advice to staff earlier tonight, and she's just a delight to work with. A lot of difficult challenges that we face. I think that the most difficult challenge facing our country, we spend twice as much as a country as the rest of the industrialized world, and we don't get the results that other countries do. And so we can't be that dumb, and they can't be that smart. We've got to be smarter. We've got to be more efficient. We've got to work together. If there's a place that can address this problem, it's a place like Delaware, where we have a tradition of working together. It is a little bit difficult here in the sense that we don't have a large population. We don't have a lot of competition among our healthcare providers, and so that makes it challenging at times to control costs. But we do have a tradition of working together. If we all come together around the benchmark process, come up with a path forward that's fair, that involves all the stakeholders, I think we can make real progress. I'd like to close with a bit of a sad and somber note. This was the first anniversary of the death of Lieutenant Stephen Floyd, a correctional officer who was killed at James T. Vaughan prison this day last year. It was a horrible day for Delaware, certainly a tragedy for the Floyd family and all those who loved him. And our hearts go out, our prayers go out to his family today, to all the employees at the Department of Corrections. Today we had a wreath laying service there at the prison. A lot of people that were there remembering Lieutenant Floyd, and I would ask you to keep him in your prayers as well. Thank you for tuning in, and God bless each and every one.